good work and the good program. One step in the overall vision of creating the country's most advanced joint management program. And in joint management, we start from the very beginning, which is the prevention. So in our master health checkup or the executive health checkup, we are first telling people how do you prevent your primary joint replacement. What are the exercises to do? How do you take calcium supplements? Women are more susceptible, post-menopause, women are more susceptible to bone demineralization. And therefore, how do you take supplements and keep your joints and your bones healthy? All these are part of the program. Post that, despite all the other preventive steps we can take, and that's why we don't say come for joint replacement, we say come to the joint clinic. In the joint clinic, the first step is try to prevent. Post that, if you definitely need surgery, in terms of primary revision surgery, of the primary joint replacement surgery, we have the best center, the highest results, the lowest infection rate. Also, I think in the last 15 years, I can remember probably one infection. So it's the lowest infection rate anywhere because we're following very advanced techniques and procedures. So for surgery, for joint replacement, from a skill set, from an outcomes of the procedure, as well as the overall experience including physiotherapy and rehab, this is one of the best centers for joint replacement. Now, as you know, patients in India have started joint replacement surgery almost 20-25 years ago. So this goes through a cycle. Now those knees which were replaced are now after 15-20 years beginning to get worn out and therefore need a revision surgery. As Dr. KJ Reddy explained, there are two categories for revision surgery. One which happened fairly close to the surgery because of complications that happened, and we get many patients referred post-surgery to come in here, and that's where the whole science of revision surgery or revision TKA is coming in. Now Dr. KJ Reddy and other senior surgeons looked at what was happening everywhere in the world. Joint replacement surgery in Europe and America started earlier than India. So their expertise in revision surgery became a little better, a little more. So the idea became, number one, let us start a dedicated program for revision surgery because it's not the same as the first time putting a joint. Number two, find a partnership with someone who can teach and train very well. Number three, let this expertise stay not only within the Apollo Hospital environment but train people from outside, and that's why the workshop is going on. So there are about 150 surgeons, Dr. KJ Reddy, and this has been done in partnership with the local association. So the Telangana Orthopedic Association, all of them are here, the surgeons are watching, and this is a workshop, so live surgeries are being transmitted, and that's why Dr. Heiko Gretchen is not yet with all of you because he's still in theatre. He demonstrated a very complex case. They have another one in the afternoon. And when you see this with the explanation, the nuances and the experience of how to do the surgery better, that is passed on. In addition, we will also be, one is announcing this center for revision TKA. The administration, the hospital will support in terms of further equipment which is required or support in terms of surgeons, coordination programs for those who are coming in for the training. And I'm very happy to also announce that Professor Gretchen has agreed that students who are learning and observers here, that he will also extend a 1-month fellowship in his unit in Germany. So while everybody cannot go, the best people from here will be selected to go for the 1-month fellowship. So this is really the program. But the bottom line is that for the entire gamut of joint management, joint health management, we have a comprehensive, one of the centers with the best results and the best outcomes, and this is a very good addition to that, where not only we will be focusing on revision surgery, but we'll also be training others in revision surgery. On your first surgery to about 60, and then if you need it, your revision surgery happens at 80, 85, you're in a very good condition. If you can postpone to 70, and then if you need revision surgery, but it can happen at 90. So one of the important steps is, to try and, with the combination of physiotherapy, exercise, food supplements, diet, and that's what we do in our protocol or our care pathway. And that's why, we're not too aggressive about the first surgery. The reason is that we try to keep the joint healthy through a natural process as long as possible and even prevent the first surgery. This is one of our stated USPs of our joint clinics. And look at what's the X-ray, what's the MRI, what are the indications for surgery. We're reviewing these because it's very important for us to take not just the incident per se, but the lifetime of the individual and be responsible for his health through his lifetime. Not just one, many of which is age related. Therefore, the supplementation during aging is very crucial. So all elderly people, specifically above 65, must be taking higher doses of calcium. All women post-menopause should be taking calcium. These are crucial factors. So the DEXA scan, as part of the checkup, studies the bone demineralization, and actually the physician can sit down and tell you, when your bones are so brittle, your chances of your joints wearing out, or your chances of the joint which has been put in not holding right. Because the artificial joint is anchored to the natural bone. If the natural bone starts demineralizing, then the screws which are anchoring it start getting loose. When the screw gets loose, the joint moves. And this causes a deterioration of the entire functioning and pain.